Hey everyone, my name is Madeline Stewart, and I'm a fourth-year medical student at LSU in New Orleans. I'm excited to be a part of the ACORE blog series, and I will be presenting today based off the article Multiparametric MRI for Bladder Cancer, a Practical Approach to the Clinical Application of VI-RADS from the journal Radiology. For additional details, or if you're interested in the sources used for this presentation, please take a look at my full blog and all the sources below. With that being said, let's begin. My presentation today is entitled From Evidence to Practice, How VI-RADS is Transforming Bladder Cancer MRI. I'll be walking you through what the VI-RADS scoring system is, how it's used, and why it matters particularly for accuracy and clarity regarding staging invasive bladder cancer. Special thanks to Sharif Ghozi for his help with this work. Bladder cancer is among the most prevalent malignancies worldwide. Some posit that it is one of the top 10 most diagnosed cancers. Historically, staging has relied on transurethral resection of bladder tumor, or TURBT, and cross-sectional imaging like CT. Both of these approaches have limitations in assessing the tumor depth. However, multiparametric MRI improves staging accuracy because of its ability to assess the muscle invasion of the tumor. The VI-RADS system adds a structured approach to this MRI evaluation, similar to the PI-RADS for prostate or the LI-RADS for liver imaging. VI-RADS was developed in 2018 by a multidisciplinary panel of radiologists, pathologists, and urologists. It's a standardized scoring system created to assess the likelihood of muscle invasion in bladder tumors using the multiparametric MRI. It's been validated through meta-analyses and other studies, and it's been applied in clinical settings that range from staging to chemotherapy planning. The scoring system ranges from 1, meaning a very low probability of muscle invasiveness, all the way up to a 5, which indicates a very high probability of muscle invasion. In terms of patient selection, the VI-RADS scoring system is most appropriately applied in two clinical contexts. First, when bladder tumors are incidentally found on imaging, and second, for staging known tumors prior to their surgical resection. Something made clear in the original VI-RADS article that has only been emphasized during its widespread use is the importance of proper MRI protocoling. Accurate scoring depends on high-quality imaging. Some important considerations in this review article regarding MRI protocoling include obtaining T2-weighted imaging sequences in multiple planes, obtaining diffusion-weighted imaging, and dynamic contrast-enhanced sequences. It is very important to note that in studies with no contrast sequences, the VI-RADS cannot be applied. It cannot be used without contrast. Other important aspects include an appropriate field of view. The full bladder and pelvic structures should be included in the view. So if there's some kind of invasion of the bladder tumor into surrounding structures, it may be completely evaluated. Next, the bladder should be adequately distended, not overfull or underfull. Lastly, the use of antispasmodics has been suggested to improve image quality due to more static bladder and bowels. Now to apply this to the scoring method. Each sequence provides unique information. For example, T2 shows lesion structure, DWI picks up on invasion, and DCE can highlight early enhancement. Each sequence will be scored separately from 1 to 5, and the highest score across all sequences determines the final VI-RADS score. There's a really helpful diagram from the original review article, Figure 2, that helps readers understand how the scoring can be applied to different lesions. If you're interested, I really recommend taking a look at Figure 2. This review article shares valuable wisdom regarding the challenges that come with using the VI-RADS scoring system in practice. One of these is ensuring that the muscle layer can be properly evaluated. As we discussed earlier in this presentation, imaging quality is paramount. Without this MRI quality, the muscularis propria cannot be adequately evaluated for invasion. Next, poor bladder distension may impede image interpretation. Regarding lesions, large, non-invasive lesions may be overstaged as muscle-invasive bladder cancer, which can result in unnecessary stress and procedures for the patient. It is important to be careful of stalked tumors and inflammatory changes from biopsy or bladder instrumentation. These findings on MRI may mimic invasion. Using a meticulous evaluation of the bladder wall in conjunction with clinical context can help avoid pitfalls like bladder diverticula, wall distortions, and tumors such as benign mesenchymal tumors, leiomyoma, malignant urachal tumors, etc. Since its institution, studies have shown VI-RADS to have excellent sensitivity and specificity for detecting muscle invasion, with area under the curve values above 0.8. Agreement between readers is also strong, showing that this is a very dependable tool in clinical workflows. Regarding the clinical impact of the scoring system, VI-RADS refines our ability to separate non-muscle invasive from muscle invasive cancers, improving risk stratification. It helps us to support better treatment decisions and to reduce unnecessary repeat procedures and improves communications with referring urologists. Current research is exploring how VI-RADS performs after the treatment of bladder cancer and how AI can assist with workflow. For example, deep learning models like UNet can assist with auto-segmentation of the bladder and bladder lesion. There's also work being done to evaluate VI-RADS performance for other bladder pathologies and as a surveillance tool. In summary, VI-RADS is a reliable and validated tool that improves staging, supports clinical decisions, and brings structure to the MRI reporting for bladder cancer. With ongoing research, its role is likely to expand. And that concludes my presentation for this blog. Thank you so much for watching. I hope it gave you a clear and concise overview of my takeaways from the article, Multiparametric MRI for Bladder Cancer, a practical approach to the clinical application of VI-RADS. For additional information and details, please see my blog below. Thank you so much for watching.